Thank you very much for the introduction. I have no conflict of interest, and I would like to acknowledge and thank my co-authors at the European Spine Study Group. So we know that unplanned return to OR for mechanical complication is one of the main issues in after the surgical management of adult spine deformity patients. And it has been a challenge to identify patient-specific risk factors for mechanical complication. And this is because the ASD population is extremely heterogeneous in terms of spine geometry, biology, and health-related quality of life. So we know now that with the help of AI and machine learning, we can create homogeneous patient clusters that help us with the further work of prediction and risk factor analysis. So what we did was using a machine learning algorithm to cluster our patient, and the question that we asked was, do we have a different revision rate, different risk factors for the different clusters that we observed? So we performed a retrospective study on prospectively database from the ESSG on adult patients who underwent surgery and they had a minimum follow-up of 2 years. The first thing that we did was clustering them based on their baseline characteristics, and secondly, we performed logistic regression and a marginal effect study to investigate the risk factors in each cluster. We obtained data from 819 patients, and these are the demographics of the clusters. Cluster number 1, younger patient, coronal deformity. Cluster number 2 and 3, older patients, mild disability. In cluster number 2, mild sagittal imbalance. And in cluster number 3, both coronal and sagittal malalignment. Now, for cluster number 1, a rate of reoperation of only 6%. This is much lower than what we know from the literature for the overall ASD population. We could see that the main issue was rod breakage, and the risk factors for this were correlated to implants and coronal and sagittal parameters after surgery. This analysis had a very good prediction rate with an error of only 5%. Cluster number 2, a higher rate of complication, 19%, a higher rate of rod breakage, but also we see PJK and PJF among the complications. And for the risk factor, we see a mix of demographic, sagittal parameters, and implant-related variables. Also a higher prediction rate, 18%. Cluster number 3, the rate of complication goes even higher to 30%. A lot of patients, the vast majority, also had rod breakage, but also we see screw breakage, screw loosening as a possible cause of return to OR, and PJK and PJF. For these patients, the prediction error was the highest, achieving 25%. And here, a bit of mixed bag of risk factors. Number of instrumented levels comes out again, leg length discrepancy, and postoperative sagittal balance. So what is our take home? We could again find homogeneous cluster of patients with artificial intelligence, and for each cluster we could identify a specific rate of reoperation, a specific type of reasons for reoperation, and specific risk factors. Now, what we will be working towards, hopefully, is that AI will help us in the future, having much more data than we do now, help us identify what are the specific risk factors for the patient we're planning surgery right now, and hopefully this will be a step towards personalized medicine.